I have taken care of lung cancer patients for more than 10 years. And there's nothing more frustrating as a surgeon to have two patients, exact same stage of disease, fully resected, same age, and one recurs and one does not. Historically, the clinical and pathological features that we've used on patients with resected non-small cell lung cancer have never taken into consideration the molecular biology of the individual tumor. It rather relies upon tumor size, whether or not there are lymph nodes involved, and whether or not they're spread to other parts of the body. It is not the ideal staging system. And so we have to do a better job of identifying what are going to be our high-risk patients. What we have found in our early-stage patients is that the recurrence rate varies widely. And so again, we're left with the question of which patients are going to recur, which patients are not going to recur, and how do we identify those patients, and what do we do differently? There's something we're missing, and the interest in trying to identify that high-risk patient pushes us to search harder for different tools. The Pervenio-Lung-RS assay allows us to do that, identify those high-risk patients, even though they stage early, and should we be offering them additional adjuvant chemotherapy subsequent to surgical resection. Now, with the Pervenio-Lung-RS assay, we're allowed to take those patients that are early stage, send those specimens to Pervenio, have them run the assay on the tumor cells themselves, and then subsequently place those patients into a category of low risk, moderate, or high risk. The first time that I ordered the test, I wasn't sure what to expect. I wasn't sure if it was going to truly impact my practice. The initial couple of tests didn't tell me anything more than what I expected. But when I did receive the patient, where it changed my recommendation, I was excited to call the medical oncologist, call the patient, and have them come back into the office and have a very detailed discussion about how I thought this could affect their overall prognosis. I had a patient that I operated on recently. We did a minimally invasive resection of her lung cancer. She did great after surgery, and her specimen was sent to Pervenio for the lung-RS assay. And that categorized her as a high-risk patient. And she was early-stage disease, and she would otherwise have not been offered adjuvant chemotherapy. In her particular case, based on the results of that test, we had a discussion with her about whether or not she would want to have the chemotherapy and the potential survival benefit. She agreed to do it, and she's having chemotherapy. We are seeing better care and better results, and I think part of that is continued advances in technology, and this is one of them. I am very excited about the Pervenio-Lung-RS assay, and I would happily recommend it to all my surgical colleagues and consider it in all of their early resected patients, and would encourage them to have discussions with their oncology colleagues about it as well. I think that it is the missing link that we've been looking for the better part of a decade, and it has become my standard of practice.